Extrapyramidal symptoms is the topic, and abbreviated EPS. And extrapyramidal symptoms are essentially side effects of antipsychotic medications that can occur. And these are commonly tested on the licensing exams. There's 4 types, and I'll try to go through all 4 and describe each of the 4 types, and then I'll tell you how each of the 4 types is dealt with in terms of treatment or management. So the first of the 4 types of extrapyramidal symptoms is something called dystonia. And a typical scenario is that some patient that is being treated for, let's say, some psychiatric disorder, perhaps schizophrenia, is placed on an antipsychotic medication and then shortly afterwards develops dystonia. So what happens? What is dystonia? Well, dystonia is described as sort of an acute muscle stiffness or muscle rigidity that can occur. And also there's spasms of the body, and the patient can also demonstrate some weird eye movements known as eye deviations. And that's basically dystonia. So think of like a muscle spasm or muscle stiffness, or some sort of forced deviation of the eyes. Now, this is treated with an anticholinergic medication, and that medication is benztropine. And benztropine will help with these symptoms, and it's most commonly given as an IM shot, so remember that, and that's actually important. And the next type of extrapyramidal symptom that can happen with the treatment of some sort of antipsychotic medication is something known as akathisia. Now, what's akathisia is the best way to think about it is a person who just can't sit still. Restlessness, very restless, unable to sit still. Also, this patient will probably stand up and sit down many times, pace around constantly. And this is a rather worrisome, troublesome side effect of being treated with an antipsychotic medication. But this can be treated, fortunately, by calming the patient down with a benzodiazepine, lorazepam. The third type of EPS, extrapyramidal symptom, is something known as Parkinsonism. And the reason this happens is antipsychotic medications basically work by lowering dopamine levels. So they lower the dopamine level in the brain. Now, when you have this iatrogenic lowering of the dopamine in the brain, you can develop actually Parkinsonism, which is essentially a condition that occurs with low dopamine levels. So you've actually caused Parkinsonism with this antipsychotic medication. A terrible side effect. Now, the symptoms of Parkinsonism, without going into too much detail, a lot of this is very characteristic. You'll see something called a shuffling gait, something called mask facies. And what's mask facies? Mask facies is basically an expressionless face. That's what mask facies means. The person may also exhibit some drooling, and the patient will also experience some sort of rigidity or tremor. So these are some of the characteristic findings of Parkinsonism. How do you treat this? Well, you can symptomatology, or the symptomatic treatment of this involves either an antihistamine, such as diphenhydramine, or an anticholinergic, such as benztropine. So that's how this is treated. And then the final EPS, the fourth and final one, is known as tardive dyskinesia. And what's tardive dyskinesia? The best way to describe this is basically involuntary movements of the oral facial muscles. And I'll give you some examples. The first one, for example, is tongue. The tongue will protrude involuntarily, so it's a rather embarrassing problem. Another one is involuntary puckering. Puckering is like, for example, when people pucker their lips before they're about to kiss somebody. That's what puckering means. Another thing that can happen is chewing, involuntarily, of course, and then grimacing. So these are some unfortunate, kind of bothersome side effects that are all characterized as tardive dyskinesia. Treatment of this, what is it? Unfortunately, there's no medication that treats tardive dyskinesia. If a patient develops tardive dyskinesia while on antipsychotic medications, the only option you really have is to take them off the current antipsychotic and switch to another antipsychotic, such as clozapine. Switch to basically an atypical antipsychotic medicine, such as clozapine. There's another one called risperidone, and that's really the only way you can treat or manage this. So let's take a look at some vignettes. A 35-year-old man is brought to the emergency clinic by his mother because of an episode of slurred speech associated with the uncomfortable sensation that his tongue is thick and curling up. The episode started 30 minutes ago. The patient is noted to be holding onto his tongue and thumb with his forefinger. When asked about this, the patient responds with dysarthria, saying that his medication has caused this once before and that he needs a shot to make it go away. The mother reports that the patient had schizophrenia for 10 years and consistently takes 2 medications prescribed by the psychiatrist. Several days ago he ran out of one of the medications but has continued to take the other one. What is the most appropriate initial step in the management of this patient? Well, it's clear that this patient is experiencing some sort of EPS, and the EPS, the extrapyramidal symptom that he's associated, that he's experiencing actually, is a dystonia type reaction. And this question actually is interesting, that he's already told you that he needs a shot to make it go away. And the shot that he needs is a medication that is an anticholinergic, and it's benztropine. And that IM shot of benztropine will be the solution to this, and that would be B. The next question. A 64-year-old man is undergoing inpatient psychiatric treatment with haloperidol. After several days of therapy, the patient complains that he feels very restless and agitated, and he cannot stop moving his legs. He paces constantly, sits and then stands, and is unable to sit still. Which of the following medication, if given during his initial regimen, might have best prevented this reaction? This is a perfect example of someone experiencing akathisia. And akathisia is treated with the benzodiazepine, such as lorazepam. So that would be the answer there. And the last one, a 54-year-old woman, presents to her primary care physician for routine yearly health maintenance exam. She denies any medical problems. Only significant medical history includes a 25-year history of schizophrenia, which has been well controlled with antipsychotic agents. 5-year history of hypertension, for which she takes a diuretic. Vital signs and physical exam within normal limits. However, the patient has noted an occasional irregular puckering and lip smacking movements. She denies having noticed the abnormal movements, and her speech is normal. Which of the following is most likely diagnosis? Well, now this is a good question, where she has these involuntary movements of the oral facial muscles, and the puckering and the lip smacking movements are really the ones described in this clinical vignette. And this is basically tardive dyskinesia. And tardive dyskinesia is managed by discontinuing the current medication and switching to another one, such as clozapine or risperidone.